Can you use the same needle twice? This is the question we will explore today, fellows. My name is Noah, and this is a video more specifically pertaining to testosterone replacement therapy, but I suppose if you're a diabetic, this would apply to you as well, or whatever. I also want to say I'm not a doctor, I'm not a healthcare professional. Consult your physician or your local healthcare professional if you want to speak with someone in that field. I'm just going to base this off of what I have learned, and that's what you're stuck with. I can sort of answer this question two ways, whether or not you can use the same needle twice. In regards to testosterone replacement therapy, I can tell you that I have used the same needle twice, but not in two separate settings. So I've never... Oh, and I let go of the fucker. So I've never, taken a needle, whether it be to draw or to inject. I tend to use a lower gauge, larger needle when I draw, and then a smaller, higher gauge needle when I inject. I've definitely pinned my leg, but then been like, no, shit stings, or for whatever reason I want to relocate it. And I've then just pulled it out and pulled it back in. That's of course after I've sterilized the area with an alcohol wipe or what have you. I guess I just wanted to confess that for some reason. Every time you pin, every time you inject the needle into your skin, it dulls. It blunts it a little bit. Now, for testosterone replacement therapy, it's intramuscular, and so it's not the same concern as you might have, let's say, if you were going for a blood draw or something like that. Because every time you do puncture the skin and you enter the body, the needle blunts, and apparently if you do it enough times, it can sort of hook. And so the fear is that you could end up with some significant bruising, you could damage your vein or something like that. But with testosterone replacement therapy, in my mind, if you weren't going beyond one or two pokes, and reinsertions in one single event, I don't personally think it's that big of a deal. You do have to understand, though, that on your skin, we all are carrying kind of an obscene amount of bacteria. We all have strep on our skin, for example. And so I do understand that there's a chance for contamination, and I think that's another good reason to go ahead and swap needles. The other reason you might want to swap needles is that they're really cheap. And so I do draw with a 22 gauge and then I inject with a 30 gauge. I have never once, nor would I ever, reuse the same needle on a different day. But in terms of testosterone replacement therapy, I can tell you without a doubt, it's not a big deal to pin and be like, oops, and then pin again. The needles are so small, the area is so big, in your outer quadrant of your thigh, for example, or your delt, that you don't really notice that the needle's been blunted. You do, I suppose, up your chance of some type of infection simply by taking it out of the body and putting it back in. But I imagine it would be super minuscule. That's on you if you do get infected. You can always play it safe and swap it. After a needle's been out, there's not a prayer I'm going to reuse it, because now it's been exposed to the air, it's been exposed to my skin, and it just doesn't make any sense not to swap. So can you? Technically, sure. Should you? Negative. No. Do not. Get more needles. Yeah. To all the people who watch this channel for TRT vids, I apologize. I've been a little bit MIA, so I need to get back at it and make this channel worth your time. See you in the next video. Peace.